has Alzheimer's, dementia, because she forgets everything. And I believe there is something going on with her brain. But her tests have come out, the scan and everything have come out clear. And they said, well, she's just got 75-year-old age brain. But I know there's something going on, and all the tests, there's nothing wrong, and I'm like, and I know she suffers from depression really bad. She's malnourished, she won't take her meds, but I know something's going on with her brain, and I'm trying hard. I mean, I pray for her every day. She doesn't believe that God is going to do anything, but I told her, you don't have to believe, I'll believe for you, because I know God will do it. But I know something is going on in her brain, and her doctors aren't listening, and they're not being as aggressive as I think they should be. But I want to help her, and I really don't know what to do.
I think it could be many different things. I don't know if the depression, fear, anxiety happens in cycles with the memory loss, but if it is something that's intermittent or cyclic, people with memory loss or even dementia may cross the threshold of having a seizure disorder or epilepsy, and that's how the brain is designed. There are memory centers in the brain called the temporal lobe, and sometimes those memory centers start to shrink or atrophy, and we call that hippocampal sclerosis. So the hippocampus is the memory center. Once it shrinks, it increases the irritability of the brain, and it can cause seizures that are not very obvious to an untrained eye. It may look like confusion, it may look like more severe memory loss, it may look like wandering, it may look like staring off into space. And the more of these episodes happen, the worse the atrophy or the shrinkage becomes, and the worse the memory becomes. So it's a really terrible cycle. Her doctors have not looked into electroencephalography, which is looking at brain waves, I would suggest that. The other thing would be just a really thorough medical workup, making sure that all her markers in her blood are normal.
Tests and assessments and things like that. And also kind of what Jennifer was saying, be your own advocate, be your advocate. So